Okay, so for the last portion of this presentation, we're going to discuss which interventions are supported by the evidence. So during the acute phase, immediately out of surgery up until around 4 to 6 weeks, the biggest goal is to maintain the integrity of the tissues and protect the healing of the tissues. So we want to ensure that it is healed fully and correctly. So we want to immobilize in a shoulder sling. Be sure to prevent external rotation, as this can move the joint out of place. And we want to make sure that we maintain range of motion in surrounding joints, such as the elbow and the wrist. Around 4 weeks, depending on the patient, we can start some early movement of the shoulder. So we can start isometric rotator cuff strengthening, still avoiding rotation, just to keep that joint in place so we can do flexion, abduction, extension. We can start with passive range of motion, eventually moving to active assistive, depending on the patient. And you want to be sure that you consult with the physician first to be sure that you stay within those ranges of motion that are permitted at that time. They can also start some pendulums and mild self-stretches to their pain tolerance. Again, making sure that they're educated on how far they can go with their range of motion at that time. Moving to the subacute phase, around 6 weeks, about 6 to 10 weeks, we can start with early strengthening of the surrounding muscles. So we can start working on scapular muscles. We can begin working external rotators and isometrics, and we can start early active strengthening, but we want to stay under 6 pounds according to one of the resources that I have used. And with range of motion, we can start progressing to active range of motion, again within pain limits and again within physician orders. We can also start more aggressive stretching by the PT, again depending on tolerance and physician orders. Lastly, for the return to function phase, around 10 to 12 weeks, we really want to get them to gradually return to overhead activities. This means continuing to work on their range of motion and slowly working towards full range of motion within their pain limits and what they can tolerate, and again within the physician's orders. We definitely want to work on proprioceptive training, especially of the scapula, ensuring that we have normal scapulohumeral rhythm. And we can also begin strength training with heavier weight. We want to make sure that the joint is stable and has a strong support system around it, so we can start working in all planes with heavier weight, again according to patient and their tolerance. So thank you guys for watching. The next few slides are the references that myself, Mona, and Keenan used. Thanks so much, and we hope you enjoyed.